I thought we might as well get together in a room, in a conference, and then we can sort of ask how this questions that we have been asking, we can answer all together so that we continue. Let me thank Professor Mala, who's an advocate for all women in the country, and he continues to provide that service that I was doing. Raising those issues. Yes. So I'm sending a message to join us in this conference so that some of the issues that he has raised in the social media, which is genuine, which is a concern for us as well. Because all of us are here to care for patients. Yes. That's the purpose of being in a hospital. I also invited the NCD PHA agency, Dr. Robinoli, to be with us so that we can put to use some of the work that we are doing with the NCD PHA to address the issues, very issues that has come up, so that that message can be carried to the public as well. And also let me acknowledge Dr. Kamuya, who's ONG consultant, and the rest of the ONG team over here this afternoon. Okay, so before we begin, let me just put in perspectives how the health structure in as far as the government policy direction is concerned. So you'll know that we have just announced the government has launched the National Health Plan 2021 to 2030. Under the National Health Plan, we have different categories of the health facilities. The health facilities and the National Health Plan is mandated under the National Health Administration Act, Section 4 and Section 5. That mandates the National Health Plan and the National Health Facility Standards. So the facility standards are level 1 to 4. Level 4 are district hospitals, and level 5 is a provincial hospital. So each province have a level 5 hospital, and then the different district hospitals, which are level 4. But Boston General Hospital is level 6. Previously used to be level 5 or level 7 they used to do, but now it's level 6. It's National Tertiary Referral Research and Teaching Hospital. That is under the National Health Plan. It will be regulated under different legislation which we are working on, so that specifically performs that function, which means the term general will be removed. It will no longer be a general hospital, which we are working towards. It will be a tertiary referral research and teaching hospital. Our mandate, as directed through this national health policy from the government, is to provide specialized health care so that Papua New Guineans who are raising exuberant amount of money, traveling to Philippines, traveling to Singapore, traveling to Australia, those services are provided here. We also have to provide the services that other PHAs are not able. So it's like for most general hospital, level 6 is the last stop for as far as specialist healthcare is concerned. But we are strategically located with the School of Medicine and Health Science. Now it is the government has also directed that this will be a standalone medical and health sciences university by 2025. Which there's a technical working group which is working together to put that new university together so that it trains the health workforce for the country, from specialist doctors to technicians to nurses, so all categories of health workforce will be trained there. So this hospital is basically a training hospital to that proposed medical and health science university. Of course, to provide training, we have to provide some primary care, some secondary care, as well as specialist care as well. Otherwise, you cannot train only specialists here, because we've got to provide a training environment. So some primary care will be maintained, and some secondary care will be maintained, and of course, tertiary care at most hospitals. So that we support the university, train different categories generation workforce for the country. So that is the government policy, and for most general hospital, now the National Tertiary Federal Research and Teaching Hospital, we have to implement this, implement the agency, we have to implement those policy directions. The Prime Minister has made it very clear in his inaugural speech when he was elected as the 8th Prime Minister of the 11th Parliament. He said, no Papua New Guineans should be traveling out of PNG to seek health services in cardiac, in cancer, and in kidneys. So through our corporate plan, we are trying to address those services as well, specialized services. So we have provided cardiac services at our hospital. We established the non-invasive cardiac center. We have established the cath lab for invasive services. We already provided cardiac surgery, but we're working on a cardiac theater so that we can do bypass heart surgery as well. So over 2,000 Papua New Guineans have been gone through the cath lab of most regional hospitals. Minimum 100,000 you will spend if you are going overseas. So 100,000 times 2,000 is almost over 30 million that has been saved, or I should say 200 million that has been saved if all were to travel overseas. Not only that, but we are providing these people with heart disease, especially coronary heart disease, working class Papua New Guineans. So we're keeping them alive so that they continue to contribute to the economy of the country, as well as containing the kina which could have gone out of our country. We're building a comprehensive cancer center, which we will commission, opened in September, for breast cancer. And I'm just coming back from a kidney transplant committee meeting, so that we can, with the National Department of Health, so that we can provide kidney transplant services to our Papua New Guinean, which the Prime Minister clearly mentioned in his speech. The transplant services must be provided to Papua New Guineans by 2025. So you will have seen that NCD PHA does not have a level 5 hospital, which other PHAs have. Central Province does not have a level 5 hospital. There is no level 4 hospital for Mosby Northeast. Mosby South, level 4 district hospital. There is no district hospital for Mosby South. And of course, Guerrero is for Mosby Northwest. So, and Gulf Province as well is also not, the facilities are run down. And everybody comes to Mosby General Hospital. So we are providing the care for a level 5 for Central Province, level 5 for NCD, level 4 Mosby Northeast, level 4 Mosby South, and some of level 4 of Central Province and Gulf as well. So everybody comes to Mosby General Hospital to provide 6 services. Of course, NCD clinics are also flooded as well with the increasing population. The government has come on board to address that. There is a plan for a Central Provincial Hospital. There is a plan for an NCD level 5 hospital, Central Province level 4 hospital. There's a district hospital in Mosby South that is soon to be opened. And there are plans for a district hospital for Mosby Northeast, which the CEO will update us. But whilst those are happening, Mosby General Hospital will continue to take on those loads. Now, coming back to the subject of maternal care. Pregnancy is not a disease. It is not a disease, it is a normal physiological process. Of course, some mothers who are sick, pregnant, they will have other diseases with the pregnancy, but for a normal mother who's healthy, it's not really a disease. We just need to guide them to the delivery of their baby in a facility. It's the labor ward. Because we do not have many of those facilities in the city. I think Monterey has just opened. I mean the public. Many go to private, but many cannot afford private. The Motoria clinic, I think two-bed labor ward that has been opened. Some deliveries are happening there. But nonetheless, everybody comes to Port Moresby Hospital. So 40 to 50 deliveries per day, and a 24-bed labor ward. So you can see the load that our team, ONG team here, go through to look after those mothers so that they can do safe deliveries. Their babies and they can go. So the post by Professor Mola is simply showing the picture of the increasing population, and then our mothers are looking for a decent labor ward to deliver and coming to promotion in Roswell. But moving forward, the plans that we have to address that, and some of which we already implementing, I can say later in the later part, but that's really the scenario that we are in now. At the labor ward of most of the hospital.
I think we should allow our coordinator to speak. Please, Sylvia.